Good morning, everyone. Another Monday. We're starting the week. Today is my consultation day, so we have the full day of consultation. We're going to go through them with you. Hey, let's see what we have on schedule. We have Angel and Lauren.
Hello.
Hi. Well, Angel, what we have today?
So we have a 12-month follow-up. We have a 2 weeks follow-up, and then we have a lunch break, and then we're going to another follow-up. We have a Skype consultation, and we have an in-person consultation.
Follow-ups, and let's get started.
Alrighty.
All right, thanks.
Hi, Dr. Mohebi. We're Snapchatting.
All right, let's see what we have on schedule. This is my first patient, a 12-month follow-up after procedure. As you can see, we did a frontal transplantation with 1717 grafts. All right, young guy came to me in his mid-20s, thinning in front and corners. You see that? It's going all the way back. Pictures from right after procedure. You see the density here and the corner. This is pretty dense with 1700 grafts, FUE. This is donor area right after procedure. You see it in different angles. Those red dots are where we remove the grafts the day of procedure. You see we have colored the hair here in the back. The reason is when patients are blonde, we don't see the grafts as easily under microscope, so we have to use the color, which is not a problem. So we just color the day of procedure. We do the procedure, and after a couple of days, everything is back to normal, pretty much. One follow-up, same patient. You see the hair is gone. You see a little bit of a pinkish discoloration still, but the new transplanted hair are gone, and patient's back to where he was before. From side, different angles, top, the back, the very top, and the back is pretty much back to normal. You don't see any sign of procedure. And guess what? A year after his procedure, full head of hair with really good density. Get it from different angles. Hairline right before and today. And again from side and today. You see how nice and dense hair is? After only one procedure. The hairline is perfectly natural. Nobody, even a hairstylist, should not be able to tell that this patient had a hair transplant done. Another angle, and look at this hairline. This is just after 1 year after 1700 FUE grafts. Full head of hair, solid hairline. That was our first patient. The reason we're doing this Snapchats are to make patients familiar with the process of hair restoration. I think that's huge. That's very important. So when I became familiar with Snapchat, I thought that's the way to do it. Patients are asking us to show them how the process works. We're going to be doing it every day. Follow-up patients, you're going to see them. If you're interested to restoring your hair with hair transplant, just follow us every day. We show you procedures with all details, follow-ups. You're going to see how you're going to look after procedure, and you're going to see how easy and painless the procedure is. Is this gentleman. He came to us in his early 60s. He had some hair transplant before for frontal hair loss and crown with not much from the first procedure. You see still thinning in front, the crown, same thing. So we decided to give him a boost. These are the numbers. We did a strip procedure. 1.8 was the width of the strip and 34 centimeter was the length of it. Patient had previously a strip procedure, so we decided to do another strip because he already had the scar, and these are how we distributed hair and hairline, front and top and crown. Oh, let's see how it looks right after procedure. This is before and this is right after. You see the front, we shave his head, of course, and we put a reasonable density. Another angle, and the front, and the top, and after. This is really important. I want you to see how I distributed hair. I did a good number of grafts in front and then on the side, because this patient is always combing from side to side. Very important for a surgeon to strategically place grafts so the patient can get maximum coverage from the limited number of grafts that we give them. This is the crown area, the same thing. We put some density, not a huge number of grafts on the crown. Crown is the least important place, and most patients we want to on the frontal areas, not the crown, but we want to give some density so it won't be as white as it used to be before procedure. Final result. This is before and this is after. Frontal view before and after. The top before and after. So you see how what I said, we put more hair here so the front can help from one side, left side can. Obviously the crown, this is before and this is after. Crown is not as full because we didn't put as much density there, and it's more challenging to fill the crown. This patient probably needed another procedure for crown. Before and after this patient, I think we did a great job with just giving him a solid hairline that was not achieved with his last procedure, and now he can comb it the way he wants without combing over or anything like that. It's a beautiful day and it's great to be out walking for lunch break, and we'll be back in the office shortly. Alright, let's see what else we have on the schedule. We have a 2-week follow-up that I'm going to show you the pictures. A man in his mid-40s, he has frontal and corner hair loss, and we restored this area. Grafts, 2212, these are a number of single hair grafts, 503, 2 hair graft, and 3 hair grafts. This is how the grafts are distributed, the front corners with a little bit more depth to the transplanted area on the left side because he's coming from left to right. Expecting to see, this is before procedure, right after procedure, some redness, some inflammation, the day after procedure, and this is 10 days after procedure or 2 weeks after procedure. Still have some redness, a little bit pinkish discoloration, which is a little bit more than usual, and this is the back area. This is very interesting. This patient came to us a few weeks ago, had a procedure for this frontal recession, and I'll show you the pictures on the procedure. You see how dense the transplanted hair is done. See the density in front and corner where we put maximum density. See a few different pictures from the other side, front and top area. He's coming back today after 2 weeks. Get maximum fullness and result because of the job he had. He has a perfect hairline. So we talked about the temporal points to just create those and add more density. Points are going back and this patient needs to restore them, but every procedure we cannot give more than 40% density, and he's in a big rush to get it as soon as possible, as perfect as possible. In this case we decided to bring him back for another procedure just for temples to make them perfectly dense and reasonably dense, and after 6 months when everything is growing we're going to do another hair transplant on the temples and on the whole frontal area to make it as perfect as he can have them. This patient brought us these pictures before his procedure. This is the kind of hairline he likes to have. We discussed this before procedure and I thought it's going to be interesting for you to see. Next one was again a follow-up. There's a patient, I've done this procedure a couple years ago. He has great density and coverage in a big area of the scalp. Class 6, we covered a big area, the whole top of the scalp with a good number of grafts, and now he want to make it even better in the hairline, make it more nice and solid. We covered a big area of the scalp, and because the area of extensive, we couldn't give him perfect hairline, and now we're going to do it with 1500 grafts to the front and corner, which will give him a very solid hairline with the quality of hair that he has, which is nice and coarse.